Hello, everyone. My name is Robert Bednarz, and I am a junior doctor in Dundee, Scotland, and you're listening to The Patient Will See You Now podcast. I have to say, this podcast is for educational use only, and you should not be using this as medical advice or opinion. Please go see your doctor if you have any medical questions. This podcast is supposed to be fun and educational. So now that I got that out of the way, let's get into this week's topic. Hey everyone, it's Robert here, and on this week's episode, I'm going to cover multiple sclerosis, or MS for short. And just a self-reflecting thing here, just a side tangent. I usually write up the transcripts for all these episodes, and every time I write up the full disease name, I write the acronym for it right after, and I realize that us doctors really love our acronyms. If you only read some of the patient's notes in the hospital, they are just full of acronyms everywhere. So anyway, MS. MS is a demyelinating autoimmune disease of the central nervous system. What does that all mean? So let's break it down. The second part of that statement is a bit easier to explain, so I'll start with that. In the human body, we have a whole nervous system composed of nerves and neurons that help us feel sensation and be able to move around by stimulating muscles and even help us breathe. We categorize them into two big sections, and they are the central nervous system, or CNS, which is just two things: our brain and our spinal cord. Then you got your peripheral nervous system, which is literally everything else. So this disease, MS, affects the brain and the spinal cord. Next, let's talk about what being a demyelinating autoimmune disease is. And without getting way too sciencey about all this stuff, I'll try to keep this as simple as possible. So first, we got to talk about the neuron, which is a nerve cell and is the basic building block of the nervous system. Let's try to imagine what it looks like, since I can't show you pictures through this podcast. Imagine a really, really skinny, naked punk rock guy that has that long, spiky hair everywhere. And just to make it a little strange, his feet has super long toes. He's naked, so he's cold and vulnerable. So let's give him a coat, a really long coat. But it's one of those long coats, it's like a bubble coat that makes the person look like a large piece of bubble wrap. So I hope you know what I mean. And that's your neuron. The coat is the important piece of all of this. So we're going to be focusing more on that coat. On a neuron, it's called myelin. And myelin acts as an insulating layer around the neuron, which helps information be sent faster to the destination it needs to be. So, for example, let's say you want to wiggle your toes. From thinking about it to sending that message of wiggling your toes down the brainstem, down the spinal cord, to the correct peripheral nerve, all the way down to your leg, to your toes, and making them wiggle, all happens at a speed of 100 meters per second, which is almost as fast as me running to the door to get my pizza delivery. And this isn't just to wiggle your toes, it's responsible for your sense of touch, moving every muscle in your body, and your cognitive thinking as well. Now, that speed is all thanks to the myelin that's wrapped around a neuron. Without that myelin sheath there, the speed would greatly drop about 10 times slower. So, demyelination is when the neurons are losing their myelin, making everything work a bit slower, but still work. Why does that happen? That's where the autoimmune part comes in. Any autoimmune disease works just about the same way. What happens is that your body's defense system, aka your white blood cells, works against you and even attacks you when you're under stress, like infection, overheating, smoking, or just everyday stress. Each autoimmune disease has the white blood cells attacking certain parts of the body, and in MS, the white blood cells attack the myelin around the neuron. Why? Just like most of the autoimmune diseases, we absolutely have no clue. But there are researchers working diligently to try and get to the bottom of it. We do know that women tend to get it more often than men, and that people who live further away from the equator, so colder climates, also tend to get them more than people who live in warmer climates, just we don't know why. Interesting fact, there's a sister disease called Guillain-Barré syndrome. Along with acronyms, there's a lot of French in medicine as well. And it's almost the same thing as MS, but the peripheral nervous system is affected and is believed to be normally caused by certain infections. This could be life threatening because this could potentially stop the nerves that make the muscles that help you breathe move, like the diaphragm. Fortunately, it's rare, and the people that get it usually come out of it just fine with various outcomes of function. So I hope you understand a little bit more of what's going on in MS. So that should hopefully be as sciencey as I'll get on this episode. Let's get to the symptoms of MS. These symptoms can be long-standing and people will have them every day, or people with MS can have flare-ups that can have an intense feeling of a bunch of symptoms at once and then reside. And this flare-up can happen as quick as a few minutes or even up to a couple of days. Since we're talking about the main motherboard of the body here, the brain, which controls everything in your body, we're going to have problems everywhere in the body. So I'll make the list short to the more common ones that happen. Starting at the head, we have diplopia or double vision, which is usually the first symptom people will notice with MS. Another eye issue is something called optic neuritis, where the main nerve letting you see gets damaged and can temporarily blind you. Speech can become a problem and makes it harder for people to talk, which is often why speech therapists play an important role in patients with MS. Also, since MS causes lesions in the brain, you'll find that people will have a hard time remembering things or having trouble with cognitive skills like reading and learning. Feeling can be a huge issue as patients can often feel tingling or numbness on their body, which is called paresthesia. They'll also catch themselves feeling really weak and unable to do certain tasks that they were able to do or even have tremors. One specific sign we find in people with MS is something called l'ermite sign. Again, more French, which is when the patient would bend their head down forward and there will be a shooting, uncomfortable electrical signal that shoots down the spine. And that is particularly characteristic of MS. Incontinence can also be a major issue in people with MS as they don't have the nerves to control their bladder or bowels, even sometimes. On top of all this, patients will often feel depressed and have anxiety, and that is both due to the MS and the psychological nature of living with the disease. A major complication of MS that most people would think of is the decreased mobility due to the muscle weakness. And you can have muscles like Arnold Schwarzenegger, but if the nerve that innervates that muscle is damaged, you won't be able to work out that muscle anymore and it will slowly just atrophy and become weak. And that's what happens in your legs, and then you won't be able to walk and carry the rest of your body. In MS, there are actually four types. You've got the relapsing remitting type, secondary progressive type, primary progressive type, and progressive relapsing type. We're only going to be focusing on just the first one that I mentioned, the relapsing remitting one, and it's the most common one. And this is where every time a person with MS will have a flare up, the disease itself in the long term gets a little worse. Let me try to paint the picture. If I were to put this on a scale of 1 to 10, let's say you start at 1 for a while, and then you get a flare up, right? When I mentioned earlier before, when you get all those symptoms at once, whatever they may be, and however long the flare up lasts. Once the flare up resides, you'll now be at a 2. And then you'll have another flare up whenever that happens. And then once that resides, you'll be now at a 3, and so on. It's also the least progressive out of the four, which is good. The rest are a combination of how fast the disease progresses with and or without the flare ups. When it comes to diagnosis, there are two main things, and they are the MRI of the brain to find white lesions in separate spots, and also a lumbar puncture or spinal tap, where doctors will insert a needle into your spinal column and take out some cerebrospinal fluid, which is the fluid that cushions your spinal cord and brain, to see if there are certain antibodies in them diagnostic of MS. Like most autoimmune diseases, MS is incurable, but manageable. There are a lot more medications out there now that can help manage the MS, especially if MS is caught early enough. What these medications do, in simple terms, are a few ways. Some medications act as a decoy, pretending to be myelin, so that your white blood cells will attack that instead of the real myelin, slowing down the progression of MS. Other drugs tone down the response of the immune system so that they won't attack your myelin. However, this can come with other consequences because those same cells won't be able to fight off a real infection as well since its intensity level just got lowered. So that's pretty much the gist of MS. And before we get to our guests, I just wanted to take a quick second and thank you so much for listening. And if you're enjoying these podcasts, if you're listening to this on Apple iTunes or wherever you're listening to, all I ask is to please leave a review and some stars for me. It really helps me out with the algorithm for other people to find this podcast as well. You can also always email me to let me know what things you enjoy about the podcast, what things you think need to be changed, or just let me know what you'd like to hear on the show. I'd love to hear from you. Now that I've explained a bit of what MS is and how it presents itself, I've had the pleasure of talking to Katrina, and we get to hear her journey of what it's like living with multiple sclerosis. Usually, the way we start this podcast is tell us first a little bit about yourself, who you are, what you do, and then we'll go into the whole medical aspect of things.
Absolutely. So I'm Katrina. I live in the United States in the Washington, D.C. area. I am a lawyer for the government by day, and by night I host a podcast called The Fraudcast.
So you want to tell us a little bit more about the Fraudcast?
Sure. The Fraudcast is based on a United States American TV show, which does play overseas actually, called A 90 Day Fiancé. It's a reality TV show on the network TLC and done by Sharp Productions. And it's 90 Day Fiancé and a variety of spin-offs like Before the 90 Days and Happily Ever After and Pillow Talk. And it's a reality TV show. And what I do as the Fraudcast is we pull back the curtain on the reality aspect of that show and reveal the fraud that's underneath.
That sounds very interesting. And I'm actually, when you told me about it earlier, I'm putting myself in the same situation because my girlfriend is not an American citizen and I am. And we were thinking about getting her an American citizenship. So I hope I don't want to be on a reality TV show, but I might watch it just for the process of it all.
Well, I would recommend episode 12 of the Fraudcast, where we interview a former U.S. visa officer who used to do the interviews for the visa process on the K-1 process, and he gives a lot of information. So that actually might be educational for you and your girlfriend for your purposes of trying to get her over.
Not a bad idea. So I think I will definitely check that out soon.
That's episode 12.
Will do. Got it. So I talked about a little bit about multiple sclerosis earlier onto the show, and now we'll bring it to you, somebody who's living with it day by day. How about you let us know, when did you notice some symptoms? When did you notice something went strange? How did this all start? And we'll take it from there.
Sure. It was a couple of years ago. It was May, June originally of 2017. It was the summer. And I had, as I said, I'm an attorney by day. I had just finished a couple of day trial. And shortly after that, and that actually has relevance here, but shortly after that, my skin started feeling numb. Like I didn't have feeling in my skin all over my body, which is an incredibly weird sensation. There's a medical term for it, but I can't remember what it's called.
Paresthesia, yeah.
Yes, that's what they called it. So it was all over my whole body, and I thought it was very weird. So I started Googling because that's the smart thing to do, right? And I discovered that I was either dying of all of the autoimmune disorders or I had a vitamin 12B deficiency. So I assumed it was the latter, and I started taking extra supplements. The same time, I called my primary care doctor because it wasn't going away. And I thought, well, maybe this is weird. And I thought it was maybe stress related because I had just come off this trial. It was a 2-day trial. It was an incredibly stressful trial. So I thought maybe my body was reacting to that. I didn't think anything serious was happening. I really thought it was stress related. So I called my primary care doctor and I got in with her, and she thought it was a little odd, and she ran a gamut of blood tests on me, including things like the lupus markers and Lyme disease markers and things like that, other various autoimmune disorder stuff, which is, as it turns out, are also mimics for MS. So part of the MS diagnostic process is ruling out these other things. So what I did then is, she also thought, she did think it was weird. So while she was waiting for the blood results to come back, she referred me to a neurologist. It was like a month before I could get in with a neurologist. So I just, whatever. I just kept on taking my supplements and stuff. As it turns out, my B12 was perfectly fine. She told me to discontinue taking the supplements, which I did. And that's when I started to be like, huh, okay, so it's not that. So what is happening? While I was waiting to go into the neurologist, I developed what I later learned was called Lermite sign, which is when you put your head down forward, like you look down at your feet, you get like an electrical sensation down your back and your arms. And I thought that was very odd. But I thought at that time, like, this is such a weird, random thing. How am I going to explain this to a doctor? And how is the doctor going to, like, take me seriously? Well, I didn't need to worry, as it turns out, because when I went into the neurologist's office, MS was immediately on her radar. And apparently this is textbook. So she did a bunch of clinical tests on me. And at that point, I still just had the paresthesia on the skin and the Lermite sign. I didn't have any mobility issues. I didn't have any vision issues. I didn't have any of the other things that would later come to haunt me as an MS patient. But those were enough to make her concerned. So she said that the Lermite sign was result of inflammation in my spinal cord, in my C-spine. And we needed to find out why, but MS was on the radar. So she sent me for an MRI, which came back showing a big, massive lesion at C2, C3 in my C-spine. So immediately then I'm like, oh shit. Oh, sorry. Bad language.
Oh, it's fine.
I was like, oh my God, maybe this is real. Like, this isn't just stress related, right? And she got the results of that back, and she sent me immediately for a brain MRI. And by immediately, like, she's like, leave here now, go get the brain MRI and come back to me in the morning. And I was like, oh, okay. So I did that. The brain MRI came back showing a handful of lesions on my brain. So at this point, we're all but confirmed that it's MS, because these are very indicative. These are indicative of what MS causes. The MS is, it causes these lesions. It's the eating away of the myelin, right? And it presents radiographically as these white little spots, these lesions on your central nervous system.
Yeah.
So, right. So after that, the next diagnostic process is a lumbar puncture, spinal tap, whatever you want to call it. And so she sent me for that, and I did that. And that took about 6 weeks, I think, to get the full panel back, because there's a ton of stuff that they test with that. And in the meantime, while I was waiting for that, I sought out a second opinion, just to, do my due diligence. And I got in with the head of the MS clinic at Georgetown University Hospital. And by then, my spinal tap results were in, and they had confirmed all of the appropriate proteins that are present for MS. And they gave me my diagnosis. So I went from symptom onset to diagnosis in about 2 months, which is highly unusual, actually, for MS patients.
So I got a lot of questions following up a lot of what you just said. So right in the beginning, when you started feeling this paresthesia or numbness and tingling and stuff like that, you started taking supplements from what you read on the internet. Which is, it's totally fine. It's understandable. A lot of people go, especially in the States, they're probably more avoidant of going to the doctor because of how much it costs. But were any of those supplements vitamin D as well?
No, I did not start taking vitamin D until my blood results came back from the primary care doctor, which they showed that my B12 levels were elevated, which is the supplement I was taking. So she told me to stop that. But she did say that my vitamin D levels were low and to start taking vitamin D. So I added that at that point. Yeah.
Yeah, one of the things with MS is usually one of the things that can trigger the attacks later that I think you have as well. It's because of this vitamin D deficiency, and we'll get to more of it later. But we'll get to it. So the next question.
Right, because that is part of it.
It's a big part of it. Yeah.
Yeah.
So you also said it was interesting because you work for the government, you're an attorney, and
Hmm.
that case was very stressful when those
Yes.
symptoms came on. Is your job normally stressful?
It was at the time. That particular the job that I was doing at the time, I was litigating in the role that I had. I was trying cases. I was doing a lot of things where my hours were really wacky. I was working late. I was in a very stressful position. I have since changed jobs so that the work that I do now is completely the opposite of that, which is very helpful because my neurologist said that it was the stress of that trial that brought on the flare that diagnosed my MS. So while I was like, oh, I'm not stressed anymore, the trial's over, I shouldn't be feeling any physical effects, that's actually incorrect in that it was the stress of that trial that brought on these things that ultimately diagnosed me. So as I'm sure you're aware, stress is one of the triggers for MS flares. So that's, in some regards, it was a blessing, I guess, because it was able to diagnose me. And I haven't, knock on wood, had a major flare up since that time. I mean, I have had an increase in symptoms and stuff, and we can talk about that, but that's the big one that I had, and it was brought on by the trial.
Yeah, so that's exactly why I asked, because exactly how you beautifully just said, stress is a huge factor in any autoimmune disease, unfortunately. And it's so easy to say, like, you just got to not be stressed for anyone. But
Right.
it's not easy to become a millionaire and just kind of lay on the beach every day and sip on a margarita or something. But that's why I asked if you were still working at that job, because unfortunately, stress, whenever you're in stressful situations, that can trigger another flare up, along with the many other things.
Right.
So and then another question I had following what you said is, when the doctor, it was a woman doctor, am I correct?
The first neurologist was, yes.
Yeah. So was she the one that told you this looks like MS once you told her the symptoms? So
yes.
Can you explain how did she break that news to you, and what were you feeling at that time? Like what? Because at first you thought it was something else. It was like, oh, maybe a vitamin supplement thing, and I'm missing out.
Mm-hmm.
But now she's here telling you, I think this, or you say it. Like how did she say it, and what were you thinking? How did you react to it?
She was very very good about it. She had a really great bedside manner in that regard, and she was really, really nice. And I had brought up, I forget how the context was, but I had brought up the fact that my brother has MS, which is an interesting, from a genetic point of view, that both that these first siblings both have it, because it's not an inherited disease. So we both have it. I think I had mentioned this to the doctor. And so she's doing this whole exam, and we're talking about the Lermites, and she said, and that, she wants to send me for this MRI. She's like, and I do want to tell you that one of the things that I'm looking at is MS. And I'm telling you this, I'm going to write this down because you're going to go Google it. And one of the things that's going to come up is MS. And I want you to be aware of that. And I was like, okay. Because she wrote down the Lermite sign thing for me to look up while I was waiting, I guess, because she knew the type of person that I was, and I was going to want to look it up. So she was very good about how she broke that news to me.
So that's really interesting, actually, that you mentioned that your brother has MS for many reasons. One, because MS is usually, on a ratio, it usually affects women a lot more than men. So that's already interesting itself that your brother has it. Two, like you said, it's not a genetic, you can't inherit MS. However, there has been some talks in new articles that maybe there is some genetic thing to it, but rather not. Thirdly, since this is the most interesting question that I have. It's, since your brother has MS, how come you didn't think like some of the symptoms you had were like, oh my goodness, this is exactly what he has? Like that never came to mind or anything like that?
Well, my symptoms actually were completely different than his. He had been diagnosed about 10 years prior. And this is one of the things that's fascinating about MS, is that it presents differently in everybody who has it. They call it the snowflake disease, not because we're, snowflakes, but because we're everybody is different, right?
Mm-hmm.
So my brother was diagnosed he had what is called optic neuritis, which is one of the things that presents, which is when lesions happen on the optic nerve, which is part of the central nervous system. So he had lesions on his optic nerve, which caused him to have double vision. So that's the first symptom that triggered for him, and he started down the diagnostic road. That's the only flare that he's ever had. So that is what he had. And so me feeling this numbness in my skin, it didn't even occur to me that it might be the same, because I didn't know anything about MS at the time other than my brother started with double vision. So it wasn't even on my radar at all when I went to the doctor. And I honestly thought it was just my body reacting to stress.
Gotcha.
Which it turns out it was, but in a completely different way.
Yeah, in one way it was, but indirectly, no. I get it. I understand what you're talking about. So also, you mentioned these flares. You didn't, since that case, which was almost, it's 2.5 years ago now.
Mm-hmm.
That was the only bad flare that you've had. Is that correct?
Correct.
So what are these other times where you feel like you have an increased symptoms? Can you explain a little bit about that?
Sure, because one of the things about MS is that there's the flares, there's like the lesions that cause like these big flares, and then there's the symptoms that you get with MS that go up and down regardless of the lesion activity in your brain. Like if you have a certain set of lesions, you have certain set of symptoms that are going to be in a certain range, and regardless of whether your lesions change or not, if that makes sense.
So with you, what kind of symptoms are those?
So for me, I deal with, thankfully I don't deal with a lot of mobility issues, although I do have some balance issues and stuff sometimes. As you said, stress is a big trigger for things. So if I'm in a situation where it's been really stressful, these things might increase. I have cognitive problems in that I have difficulty remembering words sometimes, or putting words together in a sentence that makes sense. I will blank out a lot. I will sit there, which it's a good thing I don't litigate anymore, because if I was in a courtroom and couldn't remember my words, it would be problematic. Thankfully, my job now is much less stressful, and I do a lot of reading and writing and research. So if my brain isn't cooperating, I can just take a break and come back to it. The heat flares it up as well. So I will get, my body has this inability to thermoregulate. So what happens is I overheat very, very easily. Even now, like it's in the middle of winter here, and, it can be, 20, 30 degrees outside, which is Fahrenheit. And so it's really cold and snowing, but I could be sitting inside sweating with a fan on me because my body just overheats really easily. And then once it overheats, it can't cool itself back down because it's lost the ability to thermoregulate.
So that thermoregulation bit, is that new as well? That you've never had it before, that big flare up 2.5 years ago. This is with it, right?
Correct. These are all things that have happened since my diagnosis. So occasionally I will get muscle tremors. My mobility, like I said, is pretty good. I'm able to walk, and my arms and legs work pretty well. But sometimes I do get dizzy. Or it's not really dizzy so much as it's just like I can't walk straight necessarily. I'm what you call a wall walker. I always put my hand on the wall as I'm like walking up and down stairs in my house, or even at like work, walking down to the bathroom. I have my hand on the wall because sometimes my balance can be off, and that is all completely MS related. That wasn't something that happened before. The big things I get are fatigue. My gas tank is a lot smaller than it used to be, so I can't be out running around doing the things that I used to be doing, the length of time that I used to be doing. So it's a little frustrating for me, because I will just sometimes I wake up and I feel like there's a truck parked on top of me and I just can't move, like the thought of getting up and showering and going to work is just too much for me. I can't do it. My body just won't react. So thankfully on days like that, I can just work from home. my job is such that it allows me to do that, which is good. But it's frustrating for, I'm relatively young. I'm 45. I have a young family. I have a teenager and a 10-year-old, and we like to do things. And especially in the summer, like go swimming and do all these things. And then so in the summer, the heat flares things up. So I'm just tired all the time. I have this like bone chilling fatigue. And then the other thing that I deal with a lot is an increase in pain. So for me, the way that presents is that something that would be a minor pain, my MS exacerbates that pain. So what would be a normal, like, oh, I banged my knee into a wall. For a normal person, that's just like, oh, ow, it's a minor inconvenience. For me, it's really painful, requiring, ice and pain medication and laying down, if that makes sense.
Yeah, totally. And that was actually you were bringing us to the next question, because going back to the whole medical aspect of the MS, so you've had the symptoms. We did the MRIs, the C-spine and the brain MRI. Then they did the lumbar puncture, which, by the way, how was that like? What was the... Yeah, because I know that it looks painful. I've never had one myself. I only see doctors doing them, and I'm just like, oof, that just looks terrible.
It's not a lot of fun. I mean, you're on this table and you're all hooked up, but you're completely wide awake, and that they have this needle in your spinal canal, and they're draining this fluid out of your spinal canal. And it's very strange because, they're talking and whatever, and then, you're just trying to remain calm because you can't move at all. You're not allowed to move. And then they tilt the table so that, like, my head is up so that the spinal fluid can drain more into their tubes, because they have to take tons and tons of tubes of the fluid. So it was just very, very strange. And then afterwards, you have to lay flat for several hours. Otherwise, you can get what I'm sure you're aware of, a spinal headache caused by like the blood clot or something. I'm not sure of all the details, but you have to lay completely flat for several hours, which, combined with the fact that you've had to drink a lot of water so that you're hydrated enough for them to do like the IV and all the blood work and stuff, then you're laying flat on your back and you can't move and you have to use the bathroom, and it's a whole mess. So it's not a fun ordeal, and I'd rather never have to go through it again. So.
That's absolutely understandable. And what was it painful too?
It was, I've had more painful procedures for sure, treating various like headaches that I get that are actually associated with the MS, but I don't recall a lot of pain from it more than it was discomfort, if that makes sense.
Okay. So now looking at after all that, and they finally 100% diagnosed you have multiple sclerosis, what kind of treatment regimen were you on? Are you on? Has there been changes? What does that look like?
Okay, so when I was diagnosed, at that point I'd only had what was one known flare. So we thought it was my first flare, was the assumption, just because I hadn't had anything similar that would have sent me in for a diagnosis. So everybody, the doctor, believed that had been my first flare. So he actually gave me the choice. So in treating multiple sclerosis, there's two avenues you go down. You go down the treatment of the disease itself, which are disease-modifying therapies that are designed to slow down the progression of the disease. And then you also have to treat the symptoms. And so he gave me the option about whether or not I wanted to go on a disease-modifying therapy. And the reason why he gave me a choice was because, well, treatment of MS has certainly been increased in the last few years. There's still a ton of side effects with these medications, and they are, they're immunosuppressants. They're designed in various ways to suppress your immune system, which causes another host of, side effects. And there's a lot of issues. There's a potential, brain viruses that you can get and various, like very serious side effects on these medications. So he gave me the option of whether I wanted to roll the dice and just see if I got another flare and then maybe treat it, or if I wanted to treat it aggressively from the beginning. And I chose the latter. I was like, well, if we've caught it early, and these medications, I did my own research on them, they're designed and work best when they're used as early as possible. So I made the decision to go on one. I went on one that's called Gilenya. It's an oral medication that I take once a day, and it is designed to slow down the progression of the disease by, I think the mechanism is suppressing something that has to do with like my B cells or T cells. I'm not entirely sure. But I've been on that medication ever since my diagnosis. And I've gone back in every year at least, or sometimes more if I've had a flare up of symptoms. But I've gone back in for MRIs, and it has suppressed the disease enough that I haven't had any new lesion activity since my diagnosis. So what that means is that my MRIs show the same lesions now that they did when I was diagnosed. There's no more or no less.
Oh, well, that's really awesome to hear, actually, that it hasn't progressed. So it kind of sounds like you made the right decision on what kind of treatment you should have taken.
Yeah, I mean, and it's entirely possible that it would have done this on its own without the medication, but I believe very strongly in science, and the science is very, very clear on these medications that when started as early as I did, when you've only had one flare, if you start them early, you can stop the progression. You know, I had this image of MS in my head as, you know, I'm going to be in a wheelchair in 6 months and not be able to move. And that is no longer the case. It was once upon a time because of the research of where the research and the treatment was at. But nowadays, it's not that way anymore. And I've been able to slow it or stop it. And there are lifestyle factors that are involved as well that you, I think, alluded to earlier with vitamin D and various other things and reducing stress and stuff that can help that as well, that I've taken to heart as well.
So just going back to the decision of the medication, I find it so strange how us doctors, we kind of leave up to some decisions up to the patient. And I never really know what they're feeling like. So how did you feel like, where we're like, hey, we can do this or this. What do you want to do? So well, it's like we're the doctors. We should know what's best. But obviously there are some things where we tell the patient what are the risks, what are the side effects of both, what are they like, and then we leave it up to you. How did you feel at that moment?
I actually felt good about it, because he gave me his opinion. He spent a lot of time with us, and my fiance was there with me at the time, because I, to make sure I had another set of ears to listen. And we actually recorded a lot of the conversation with his permission so that we could go back and review it. He took a lot of time to explain what the science was. As a lawyer, as somebody who analyzes things and researches things, I wanted the down and dirty details. I wanted to read the medical review articles. I wanted to read the peer review articles on this stuff. And he was able to explain this stuff in such a way to me that I didn't have to go and read those, right? Like, he took a lot of time to explain what the situation was, and then the various medications, the various categories of medications, because there's 3 categories of medications. There's the injectables, there's the orals, and then there's the infusion type, right? And then the infusion type they like to save as a second or third avenue if the other ones don't work, but the injectables are the first generation ones, and we've come a long way. So the oral ones are ones that he'd recommend. So he recommended there's 3 oral medications. He explained the pros and cons of each and what his experience with his patients had been with each. And I asked him if he had, one that he would recommend specifically for me in my situation, and he didn't. He said he would go with either of, any of the 3. So he sent us with the information and let me make the decision of those 3. So, this whole range in this universe of medications, he did narrow it down to what he thought would be the most effective for me and the most tolerable for me, because if the side effects are so intolerable, you're not going to be compliant with it, right? So why bother? So, he sent us with that information. Again, he allowed us to record it so that we, if we didn't remember what he was saying, and we could go back, and I could spend a lot of time reading about each of these things and patient experiences with this stuff and make a decision. And it was fairly easy for me to make the decision to choose the Gilenya. And I've been very lucky in that I haven't had any side effects from it other than it's doing what it's supposed to do. So I've been very happy with
Well,
it.
that's really good to hear. I'm really glad that it seems like you picked the right drug to make sure the disease hasn't progressed and that you haven't had any side effects. So another another aspect I wanted to ask, because you, I want to go back to your brother a bit because he has
Mm-hmm.
MS, and you mentioned
Mm-hmm.
earlier how you saw this picture of I have MS, and in 6 months I'm going to be in a wheelchair. Like, can you did you ever go to your brother for advice? What kind of stage is he in with the MS? Just a little bit, just to have a more understanding of what you were thinking, I guess, in that when you found out you have MS and all these treatment options. Did you do you have a because there are different types of MS. There's four different types. Did it affect
Mm-hmm.
you differently than your brother? Just more on that.
Right. So when I first found out that this was a possibility, now my diagnostic process was very quick in that I had two MRIs and a lumbar puncture within a 5-day period. So I didn't have a lot of time to ruminate on this, but I did reach out to my brother and say, "Hey, this is what, they had for me. Suddenly this is what's presenting." And we did talk about it. And mine is completely different than his. Like, he has only ever had this optic neuritis issue. I have yet, knock on wood, to ever have an optic neuritis issue. So ours are completely different. He was diagnosed at this point, 12, 13 years ago, and the medications available were totally different. So his choice of treatment, he did choose to go on a DMT, disease modifying therapy at the time, but his options were different. They were much more limited than what I have. So my choices isn't something that he was familiar with. So we might as well have had two completely different diseases, even though they're both MS. They presented very differently in us. He has only ever had that one flare up as well, which means his disease modifying therapy has done very well. Now we both deal with the symptoms, the intermittent symptoms of the fatigue and the heat and the pain and those kinds of things, but that's just part of MS is what what they say, that's just dealing with it. Right. So we might as well have two completely different diseases. But it is fascinating, my poor mother, having to deal with two of her children having lesions, holes in our brains, as it were. But
And not only
yeah,
that, it's also like she's like, oh, now my daughter has MS, but and she's like, okay, I think I know what it's like. I think I know exactly how this is going to be, and your symptoms are completely different than your brother's.
absolutely,
So
absolutely.
it's like a whole nother new thing.
It is. Yeah, like I said, it might as well be a completely separate disease the way that they present. My brother was able to give me a lot of advice and help about going into like the lumbar puncture because he's had several of them during his disease course. So I was able to, he had like the really bad spinal headache and things like that. So I knew to prepare myself for that if that was a possibility. He was very helpful for that regard for the diagnostic. But we're both at completely different points in our lives. Like, he and his wife are considering children. So he has to be careful. He's more limited on the kinds of medications that he can take, whereas I'm well past having any more children. So that is not a consideration for me when I'm choosing medications to treat the disease and to treat the symptoms, because I am on a host of medications that help treat my symptoms as well, like the paresthesia. There's something called an MS hug, which is like your intercostal muscles spaz out, basically. But it's not a muscular thing. It's actually a nerve thing. So it's like your normal muscle relaxants don't help. So there's medications for that. There's a medication for the fatigue. There's medications for the pain, all of these things. And I don't have the considerations of its effect on my fertility or possible future pregnancy, because I have a 16-year-old and I have a 10-year-old stepdaughter. I'm done. I'm not having any more. But my brother and his wife are considering children. So they have to take that into consideration. So, and because his symptoms are completely different than mine, it's like I said, we have two separate diseases, even though it's the same disease, which I think is maybe, you have insight from the medical community side that how do you go about treating this research and treatment of this monster of a disease that is so different in every patient?
I can completely understand it, and just from experience, my mother has MS, and I know a lot of what it's like just because of growing up with it. And she, unfortunately, at the time, the treatment options weren't that great. So there were only just these injectable ones like Copaxone. That's like the more popular one.
Mm-hmm.
And she switched now to the oral one, the pill one. But just watching her uh, deteriorate, and she's now in a wheelchair and she can't walk too much, but her hopes are still high, which is great. She's a very strong woman, and uh, it's weird that there's ever since I was young, I would always read that they're doing research and treatment, but it's just all of these autoimmune diseases. It's so tough that there's no cause for the autoimmune disease, so it's extremely difficult to cure it. That's why all these autoimmune diseases, unfortunately, are incurable, and we can just help slow it down and
Right.
and like you said, and just treat the symptoms like the fatigue, the paresthesia, the pain. I'm sure you're taking some kind of medication for the pain as well,
Mm-hmm.
and any kind of nausea that you might get and stuff like that. So
Yeah, and all of the medications you take for the symptoms have their own set of side effects that you have to deal with.
it's a vicious cycle. It's
Yeah.
yeah. I can imagine, like, hearing it from you. It's great because it sounds like you're very like motivating, and you also have like a really strong personality, and you're moving forward. You find humor in these things, which is great.
You
And
have to. You have to,
yeah, I agree. I feel like you do have to, because otherwise, if you don't, it's not even the disease is not going to kill you. It's just dealing with everything else.
Yeah, and I think that's people ask me how I, deal with, they're like, you have a family and you're a full-time lawyer and you also have this podcast, and I do a lot of work on the podcast, and all of these things are like, how do you do this and you have MS at the same time? And a lot of what MS is for me is learning to adapt your life around it and accepting the limitations when they're there. I like to run, and my running has been limited due to pain because I have this particular kind of headache that I've been in the process of treating, but it causes a great deal of pain and it limits me. When I have it, I can't really go out there and run. And if I'm having a really bad fatigue day, I can't go out there and run. But then there are days where I can go run 4 miles and I'm fine. But then I also have a handicap parking permit because, like, in the summer when the heat is flaring up and my body just feels like a Mack truck is parked on it, like the thought of walking in a parking lot to a grocery store is just overwhelming and I can't do it. So having the handicap parking permit helps to be able to go and do daily activity, what they call daily activities of living, right?
Mm-hmm. Yeah.
Go out and run around. I'm 45. I should be able to, I have a 10-year-old and a 16-year-old. I should be able to be out and active and doing these things. But there are some days where I'm just really limited, and I just have to accept that some days that's the way it is. And if I'm going to be laying in bed that day because I just can't get up, that's just the way it is. And I have my laptop and I have my Kindle and I can watch my TV shows, and my podcast is based on TV, so I can at least, do that part laying in bed, My work is such that I can do it from my bed because I read and I do everything on a computer. So I can do that from bed. I don't have to be in a courtroom. I don't have to be meeting with the public. I don't meet with witnesses. Everything I do is through electronic case files.
Oh, that's really awesome too, yeah.
Yeah, or on the phone. So I work from home 3 days a week as it is, but if I'm having a bad day, I can also work from home. Additionally, I have reasonable accommodations in place that allow for that. If I'm having one of my bad headache days, I can leave the office, Those are things that I have in place to help. And my work, thankfully, my supervisors and my management is all super, super supportive and very helpful. And even recently, so I've recently started having some issues where I'm forgetting stupid little things at work. Like, I can handle big, complicated legal analysis of deep legal issues, but I'll forget to turn my time card in, or I'll forget to do a spell check on a letter that I wrote, do these little minor things. So I have instituted checklists at work to make sure that I don't miss the salutation when I write a letter. Stupid little things that if I'm not focused, if my brain isn't completely there that day that I'm writing a letter, I don't necessarily realize that. But my supervisor was like, hey, you're missing these little things. And so I started implementing checklists at work. So every time I write a letter, I go through it and make sure that I have all of these little things. I have Note Up to turn my time card in. So these are all things that I do to adapt to what MS brings to me.
So
and I sorry.
I'm sorry, but you mentioned like all this stuff at work, but this is for you, it's a relatively new thing still. I still like to say it's new because some patients have had it, like you said, like your brother, for over 10 years or 20 years.
Right.
Have you missed out social events just because you were just too tired, or
yes,
like you're hanging out with your friends and you're like, honestly, I have to go home because I have this headache, and has that ever been in the way?
Yes. In fact, I mean, that's probably the biggest thing that I deal with is, I make plans to go to this, that, or the other thing, but it's always contingent upon how I feel that day. And there have definitely been times where I'm supposed to be somewhere at on a Friday night or, whatever, where I've had to cancel because of my headache or because of the fatigue or because of whatever, something that has to, you know what I mean? Like, just, I can't see getting out of bed. And I have had to cancel those kinds of things. And my friends are really fantastic and understanding. It's harder when it's like my son's school events, and I'll push through and go to those things. But I also have gotten pretty good at adjusting my days. It's like if I know I have this event that I need to go to, I'll be careful not to push myself earlier in the week so that I can make sure that I'm okay for that. Because if I run out of gas too soon in the week, then I'll be just screwed for the rest of the weekend or whatever. So I have to plan ahead, if that makes sense. If I have something important that I need to go and handle, or I'll push through it and just manage and just get through it, but then it'll knock me on my ass for a week afterwards to recover.
Another thing that's so interesting about MS that you mentioned that when it gets hot outside, when it's hot, you feel worse. You feel relatively worse when it's hot outside. And I saw that with my mother as well. And I don't know how much you've researched about MS, but one really interesting thing about this autoimmune disease is that more people are found to have this in the colder climates, so further away from the equator. So in the Scandinavian countries, European countries, a lot of people have MS as well, whereas people who live in warmer climates tend to not have it. And another study with that is because of the whole vitamin D supplementation and stuff like that. And it's interesting because my mother, about 7 years ago, with my dad, they moved to Florida from New Jersey, where there it's much warmer. So at the beginning, it was tough for her to adjust. But what's interestingly enough, she did have less of the flare-ups. And I was like, holy crap, this is totally true. If you're and I was like, this is so weird because I'm like, you're not going to survive because in the summer you're a wreck.
It's terrible
unless the air condition is on full blast. But she's living in Florida every day, and the flares are less often. They don't come as often as they used to, and they're not as bad. And I was like, wow, this is totally true.
Yeah, it's fascinating because, like we touched on earlier, the genetic factors involved are actually very small, even given that, the fact that my brother and I both have it, that's actually less of a genetic anomaly, I think, than other things, because it is not an inherited disease. It wasn't like he was having it, was an additional risk factor for me to develop it. They're discovering that it's a lot more environmental than I guess the environmental triggers are, pulled the trigger, so to speak. Yes. Vitamin D is, I've done a lot of research. I take a lot of various supplements to help. And because there is a lot of research about these various supplements, particularly vitamin D, this vitamin D therapy, I'm on a very high dose of vitamin D, just an over-the-counter dose, not I go in and get infusions or anything. But it's hard because I don't want to go out in the sun because the heat flares it up, but I need the sun. So because that helps. So the vitamin D helps. I also I have very, very pale Irish skin, so I'm very susceptible to,
Oh,
skin cancer, things like
yeah.
that. So I'm very, very careful about my sun exposure. So, perhaps that's the genetic link my brother and I have, because we have, the same inherited Irish skin, right? So we don't spend a lot of time outside in the sun. We're both very, very pale. So, maybe that's a factor, but this a lot of the research, and there's anecdotal research, but then there's also the scientific research that goes into the supplements and the ways to treat it, like reducing stress and all of these other things that you can do to manage your symptoms and possibly manage the disease. Like, so I used to be a smoker, and when I was diagnosed with MS, I quit smoking because the science is very clear that smoking progresses MS. So why am I going to be spending all this time and money and effort on trying to slow down my MS, but also smoke at the same time and increase my risk, right? So I was able to quit smoking because of that. That's one thing I was able to do. I increased my vitamin D. I take a variety of other supplements to help. Think like magnesium. I take fish oil, some of the basics. But then I also take like a mushroom supplement to help my brain, my cognitive function, which the science is iffy on that, but I see a difference whether it's placebo or not. I don't know, but I feel like there's a difference when I take these things, alpha hydroxy acid, these various things that you can do to help your individual response to the symptoms. Same with like diet and exercise. Like the science has proven that if you exercise more, that helps your fatigue. But if you're so fatigued you can't exercise, how is that helpful?
Exactly. Yeah.
Right.
But
So I'm actually
with all
about to
this,
be in a. Go ahead.
sorry. So I was gonna say, with all the supplements that you're taking and everything, you must be doing something right, because with the medication and taking all these supplements, whether you think it's a placebo or not, that's also going to bring down the stress level in your head, thinking like, oh, this is working for me, I'm doing great, and it's just overall helpful. So as much
Mm-hmm.
as it is an autoimmune environmentally triggered disease, it's also very neurological and psychological. Whereas as long as you feel better, that will motivate you and drive you to move forward and do better as well.
Right. And I'm very, very motivated in my personal wellness. I do a lot of meditation. I do a lot of stress relief in that regard. My running will help that. The exercise helps, the science is backing that as well, that exercise helps your mood and things like that. I came into my MS diagnosis as an alcoholic in recovery, and my personal program of recovery involves a lot of meditation and self-care and wellness and stress relief, and I have had to learn these other avenues of reducing my stress and acceptance, and this other, I guess, mindfulness, things that fall into the category of mindfulness, that I came into my MS diagnosis with a really big toolbox of those kinds of things. And I think that what proved me very, very helpful in my dealing with the MS, because I'm able to reduce my stress. When you're able to accept the world around you and accept that these people are this way in this situation, it is what it is. When you're able to do those things, your stress level is down. And when my stress level is down, my symptoms are down. So I feel very lucky in that regard, that I have this toolbox already, and that I know my brother was like, "Oh, can you learn how to meditate?" And I'm like, "Oh, I already know that." I'm already really into that, which is helpful, by the way, when you're doing 2-hour brain MRIs. When you're in a tube,
Yeah.
when you're in a tube for 2 hours, and you can't take medications, other people can, but I can't because of my recovery status. So I've learned how to meditate through those, being stuck in a tube for 2 hours.
My goodness. So we're gonna wrap this up slowly, and
Okay.
usually what I ask all my guests who are on the show, when they come on here, I usually ask them, what kind of advice would you give to somebody who was recently diagnosed with multiple sclerosis, or to the person who knows and has a loved one who is diagnosed with multiple sclerosis and doesn't know how to react or doesn't know how to help, what kind of advice would you give to those two types of people?
Probably my biggest advice is learning acceptance of what the disease means to you, in that the disease is not a death sentence. That's what I thought when I first was diagnosed, that I was going to be, confined to a wheelchair in 6 months. And, don't get me wrong, there's still times when I have bad days when I think that that's going to happen. But I approach it, as you've said, with humor. And I would suggest people do their research onto what the disease means for them and what the disease means for your loved one, if it's your loved one, and accept the limitations. And that the limitations, if whatever they are for you, it doesn't mean your life is over. It just means your life is going to look different now, but different doesn't mean bad. Different is okay, and you can adjust and you can adapt. And to support a loved one in that, understand that if one of their limitations is they just suddenly have this bout of fatigue and they can't get up out of bed, just to accept that and not try to push them past it, and to support that they may have these new limitations and that their life may look different, but that doesn't mean bad, and it's just different. And we're warriors. We call ourselves warriors, right? Because we fight through this stuff, and you can do it too.
Katrina, that is exactly right. You are a warrior. You are able to deal with this disease every single day. You're kicking its ass. You're doing great. You even quit smoking on top of that, which I know is not easy. I was never a smoker, but I've seen people try to quit many times and just unsuccessful. You are doing great. Thank you. Thank you so much for coming onto the show and telling us your journey and what it's like living with multiple sclerosis.
Thank you so much for having me.
Is there anything else you'd like to say?
No, I just thank you for having me. It's been great. And I look forward to hearing more of your episodes. These have been really fascinating.
Great.
I started listening to them when we scheduled this, and they're really, really interesting to me.
Thank you so much. And I'll be sure to listen to episode 12 on the Fraudcast.
There you go.
Great. Thank you so much again. And until next time, all right?
All right. Bye-bye.
Bye. If you like this episode, please leave a review, and also make sure to subscribe or follow on whatever platform you're listening to this on so you can catch the future episodes as well. If you want to be a guest on this podcast, please send me an email with a background of what disease you're living with to thepatientwillseeyounow@gmail.com, and I'll let you know if you're selected to be on the show. Don't worry if I haven't gotten back to you right away, because I might get you back for a later show. And if your condition was already mentioned on the show, no worries. I like to show how one disease can affect different people in completely different ways. Again, thank you so much for listening, and catch you next week.